All right, it's 4 o'clock. Today's update, I believe, will be very short. Let's start the way we always start. Some feel that the world is changing. I saw a poll that many people feel like the world's out of control. We got to breathe. We got to stay calm, and we got to know that we're going to get through this together. So this time we'll just do it once. We're going to get through this. We're going to get through this together. We're going to get through this together because we've already shown that we have what it takes. We adhere to the rules for healthy at home, healthy at work. We can continue to try to manage this virus until there is a vaccine. I believe that we can do it. And while we see many other states with escalating cases, here in Kentucky, we've got to continue to do everything we can to ensure that we can open and reopen safely. Today's update is going to be of limited value on COVID, and that's because there is a backlog in the federal system. It's called NEDS that we put our results into, and because of that, a significant number of results that would have come today are going to come tomorrow. So our number today is really low. You should not read anything into that. In fact, we probably ought to average it tomorrow. What I will try to do in tomorrow's release is put the full number, today's and tomorrow's, along with the full number of tests so you can get a better idea. So today's number of new cases is 69. Again, you should not read that as we have had a significant decline. That does not include some positives and some negatives that we know exist, but we don't know the numbers until that system is uploaded. Again, that is a federal system that we work through, and because of some changes they made, the upload did not occur as it normally does, and we had to wait to submit it again. So total number of cases as of today, 11,945. Of those, 308 are probable cases. The rest are lab confirmed. Total number of tests to date, 308,786. Total number of people ever hospitalized, 2,406. Currently hospitalized, 514. Ever in the ICU, 967. Currently 81. That's up a little bit. Total number of people recovered, 3,379 that have been reported to us. And looking at the overall numbers, we've undoubtedly had significantly more people recover than that, but we have to get that confirmed and sent to us. New cases from today, 14 are from Fayette, 7 are from Jefferson, 4 from Allen, Davis, and Warren, 3 from Boone, Campbell, Garrett, Logan, and Marshall, 2 from Hardin, Kenton, Pulaski, 1 from Breckenridge, Callaway, Casey, Estill, Harrison, Henderson, Jackson, Madison, Marion, Mercer, Ohio, Trigg, Wayne, and Woodford, with 1 unconfirmed to date. Now today we are sadly reporting 9 additional deaths. These are 9 families that are going to need us during this difficult time, a time where there is already anxiety, because it's going to be harder during this time to grieve when these losses would already be so difficult. They start with 3 individuals, all from the same long-term care facility in Boone County, an 85-year-old man, an 80-year-old man, and a 74-year-old man. We know their families are going to need us during this time. There's also, we lost a 68-year-old man from Jefferson, an 81-year-old man from Kenton, a 69-year-old man from Fayette, a 63-year-old woman from Kenton, a 75-year-old man from Gallatin, and a 93-year-old man from Jefferson. Listen, I know we've been dealing with COVID for a while, and I know we're going to have to deal with it until that vaccine comes. Let's not let fatigue get in the way of our compassion. Let's continue to light our homes and businesses up green. Let's try to do even more, because as the days feel longer, as our endurance maybe gets thinner, let's make sure that we do those small things that can help other people around us, that can lift them up, whether that's the chalk art that we've been doing, where somebody having that tough day sees an expression of joy or caring, or maybe it's that family that, having lost somebody, feels like they need to go for a drive in their neighborhood on a night that their feelings are overwhelming them. Let's have those green lights out there for them to see. And remember, our compassion can extend not just to folks who have been lost, but to everybody that needs compassion across our Commonwealth and across our country. The total number of people that we have now lost to date is 493. So we are approaching 500 individuals lost to COVID. It is well under what any of the models had at this point, and so because of the work of fellow Kentuckians, we saved tens of thousands of lives, but still, losing close to 500 Kentuckians is hard. We just got to make sure we continue to do what we can do each and every day to try to prevent the spread from reaching those that it could really harm. Racial and ethnic breakdown of cases, 72.94% white, 15.4% black, 5.98% multiracial, about 5% Asian, and it's about, on ethnicity, 83.5% non-Hispanic and 16.5% Hispanic. On the death side, 79.4% white, 16.95% black. Again, that is double the rate that our Black and African American Kentuckians make up of our population. 1.93% multiracial, 1.72% Asian, and on death by ethnicity, 96.62% non-Hispanic, 3.38% Hispanic. Again, looking at our long-term care facilities, this is now the only one of several slides we used to put up. That's because Green River has thankfully stabilized. Western State, we didn't have new cases for a long time. That stabilized a while ago. But this continues to be where we see the greatest harm. So from yesterday, there are 19 new residents that have tested positive, 11 new staff members, 1 new death. And one piece of good news, there are no additional facilities since yesterday that have reported a COVID case, and that means in either staff or in their residence. And our only other announcement for today, I have asked the State Historic Properties Advisory Commission to meet tomorrow. And I've asked them to meet tomorrow to vote to remove the statue of Jefferson Davis from our Capitol Rotunda. It is long past due to remove a statue that some kids who come into this Capitol, a Capitol that's supposed to be the people's house and there for everybody, see as a symbol that they don't matter, a symbol of the enslavement of their ancestors, and a symbol of the continued systematic racism that we see in so many parts of our society. In this Capitol, in a place of honor, not in any historic context, we ought to want to be a welcoming place for every Kentuckian, where every Kentuckian can come in and feel like their government is listening to them and not have to stare at a symbol that suggests that they are lesser, because no one is lesser. We are all Kentuckians, and I believe in Team Kentucky. I think this is a step we have to take for all of us to prove that we are Team Kentucky. I've had, through my administration, and folks in the governor's office have reached out to members of the advisory commission. We expect a bipartisan vote in favor of removal of the statue tomorrow. It's my expectation, and we've let each of the individuals know that that's what I'm asking. It's important, and it's time. Provided that that vote goes through, we will begin the steps for the removal of the statue. So with that, we have a number of reporters with us today. from Daniel DeRochers to Lawrence Smith to Karen Czar to Stu Johnson. It's a big day today. I think we got Mike Valenti in the back, Joe Ragusa, Chris Williams, Joe Sonka, and Tom Latek. Great. So we'll begin. I'll tell you what, Daniel, welcome back.
So we're seeing rising cases, particularly in Fayette County, Jefferson County, Warren County. In Fayette County, it's been 600 new cases just since reopening. When you look at the future and reopening, that sort of thing, are you going to target specific counties for allowing more things to happen and not allowing more things to happen when you start loosening up thresholds?
So the question is seeing a lot of new cases, especially and by percentage in Fayette and Jefferson County. And part of Fayette is the federal prison, but not all of it. There has been an increase. Will I be looking at certain areas, maybe to not move forward at the same pace and on the same schedule? And that's something that we'll work with local officials on. Local officials have always had the opportunity to do less than where we're moving. If we have a significant regional outbreak, and we're forced to pause, our hope is to pause just regionally at that point. But it's something that the local health departments are also going to be critical in what's the explanation. We certainly have more information now available to us and the ability to go in and do widespread testing, even in a neighborhood, if we need to. You know, what we were able to do at Green River, if we had to do at a different facility, it's available. And now we've got about 3 different labs. And we went through this in the meatpacking facilities that can come in and test 8,000 people over the course of a weekend. So we're going to have a lot of tools at our disposal to try to address those as they occur. Now we're seeing spikes in a lot of states. And with more contacts, with reopening, we're going to have more cases. We're going to. The question is, are those that are getting the virus in harm's way? Are they getting sick? So the numbers we're really going to be looking at is hospitalizations, ICUs, and ventilators. And especially the ventilator number is still in a very good place here in Kentucky, meaning most of our ventilators are free and very few people are on one. Lawrence. If the commission does not act in favor of removing the statue, I will look at every other option I can. But we have called each and every one of the individuals. The law suggests that they have authority on it. We believe that we will have the votes. So if it gets it done, we want to get it done. I'm not worried about the process that we get through, just fulfilling a promise. Not just that I made, but that I think our Commonwealth and our country made to all of the individuals that live here and across the United States. Stu.
The openings for testing quite a bit recently. Do you think that there's some anxiety or apprehension because of concerns about discomfort, or that the sick person could spread it to a tester and to someone else?
Can you put up the slide, especially on the Kroger signups? The question is on testing and us seeing fewer signups than we previously had. I want to take this as an opportunity to point out that there are still chances to sign up tomorrow in Louisville, Lexington, and Bowling Green for the Kroger testing sites. And then across the state, there are 180, I think, testing locations. I believe that one of the things that I mainly think that we're seeing testing fatigue. We're seeing folks that have been tested once, but not necessarily wanting to go again. It is not comfortable. Though the drive-through testing site is a self-swab, and given that I've had the medically administered swab, the self-swab is not nearly as, it's not painful, but it is uncomfortable. But a lack of comfort is a very small price to pay to ensuring the safety of people around you and of the community as a whole. So we continue to see a lot of tests, and that's a good thing. And now we're having a lot of them that come in because hospitals administer them, before they would do a procedure, for instance. But we've got to continue to push how important this is out to the Commonwealth. And for any of those that have been involved in demonstrations and marches, get a test. It's a way to make sure that you're safe and the people around you are too. Karen.
Lauren, you said you would move as quickly as you can to move that statue. Are we talking hours, days, weeks? What happens next?
So we don't have a specific timeline on the removal, but I want it to happen quickly. We are right now determining the steps and what it would take. That's why you see a ladder or some measuring tape in there. Once we have the authority, we're not going to wait. We're going to start taking the steps immediately. Though it's a big statue. And we want to do it to make sure that we don't damage the Capitol or the statue, that we can make sure that it's done in a manner that it should be. But we want to move as quickly as possible. Mike. So the question is a national use of force standard. I want to see what people are actually putting pen to paper on that. Civilian review boards, I think, can be really positive tools if you're going to do them. Subpoena power is going to be important. How they're made up, though, is also important. We want to make sure that we create boards of folks that are educated in the circumstances that they'd be looking at, and that there is opportunity for dialogue between law enforcement, those that would be on the board, and those in the community. I remember several years ago, there's a columnist in Louisville who was appointed to a board related to law enforcement, and initially people thought, how could that work? Well, once people start talking and learning about each other, I think that it's always a positive, and we always see forward movement from it. Joe.
To the issue with the data for today, can you kind of explain a little bit more the federal data collection and where that fits in the whole kind of chain of command as far as data reporting in general?
So we get, we have to upload all of our tests to a system called NEDS, and that's a national system. It's how the federal government gets all of their information, but it's also what generates all of our reports. Because we have all the reports coming in from different places, it's uploaded to that, and then it comes back to us. But because that system, for our purposes of uploading it, I'm going to say was down, and that's not the most technological explanation of it, but because it was not accepting that upload, we don't get the report back. So we think there's somewhere between 5,000 and 8,000 results, positive or negative. I don't think that there are that many positives, certainly, but that many cases going in that aren't on today. And so I just want to be really clear and transparent that I would not take today's low number to mean that the virus is receding. I think it's artificial in many ways, like Sundays can be artificial. This one maybe even more so. Chris.
Governor, earlier today, Senator Christian McDaniel said he's pre-filing a bill to replace the Davis statue with a statue to Carl Beshear, Kentucky veteran. Two questions involved with that. Do you support that plan? And also, he mentioned that by relying on this commission, as other politicians have, it's been passing the buck and not real leadership. If you're insisting that they vote to get rid of the statue, is the commission really having an independent vote? Why not just remove it yourself?
How is the commission not having an independent vote if they come and meet? Because I've asked them to vote a certain way?
You said earlier that you told them that you wanted them to vote to remove the statue.
Right.
So it's not...
Right. I want the statue removed. I'm going to call up appointees of a commission. I didn't appoint all of them and tell them what I very strongly believe. I call that leadership. I don't think it's a lack of independence by the commission. I've committed to doing what it takes to remove the statue. I believe the commission is going to vote to remove it, and it's going to get it done. Now, there would be those out there that said if I didn't call it, was I acting appropriately under the law? Listen, I think we're going to get it removed. I think the vote's going to come tomorrow. I think we've shown the leadership to get that done. And if people support its removal, why try to poke holes in it? We're taking the steps to get it done, and I think we're going to get it done. There was a senator today who suggested a very famous Kentuckian, Carl Beshear, be the next statue that's up in there. I think that's certainly worthy of consideration, and certainly an incredible Kentuckian. I think that there are just generally three options with what could be done. Number one, I mean, it could be used for extra capacity in the rotunda. Number two, we could determine a permanent statue to go in its place. Number three, we could have a rotation of different statues that could come in and be a part of that. I think it's going to be a really exciting opportunity for Kentuckians to come together and to make a decision on something new. But I think Carl Beshear is an amazing Kentuckian and would be someone absolutely worthy of conversation, of having their statue there. Joe.
You have a plan for sending children back to school for the following school year, and will that be left up to individual districts to make that plan, or will there be a statewide plan for the fall?
So the question is, when will there be a plan about getting back to school? And one of my main priorities is getting kids back in the classroom this fall. That and safely reopening, within the COVID context are the two things that we want to make sure we do: get the economy back up and running and get kids back in school. On Monday, Lieutenant Governor is going to present on the task force that's been working through the Kentucky Department of Education on those plans. It's been a very active task force with a lot of communication with superintendents. My expectation is that we will put out a plan that makes all of the best recommendations, but it'll ultimately be up to each superintendent on the implementation. Remember, superintendents shut down our schools, not the state, and our expectation is that superintendents will take it very seriously. Tom.
Some office settings are currently at 50% of capacity, as is your office, I guess.
We are under.
You're actually under, okay. Is there a move afoot, like you've increased restaurants and some of the others from 33 to 50%? Are you getting ready to issue guidance for a phase 2 on offices where they could increase beyond that 50%, and will they have to wear masks still and social distancing?
So the question is on offices which are at 50%, and is there a next phase that'll increase that percentage, and will they still have to wear masks and social distance? Let me say, until there is a vaccine, masks and social distancing are both critical, and I anticipate there will at least be a recommendation in any plan that comes out, unless we learn very different information. And we don't have a date set yet for increasing that percentage. What we hear out of the White House, and again, most of what we're doing is within the White House plan, which is put together by President Trump and Vice President Pence and Dr. Burke and Dr. Fauci, is a whole lot of what they want to see, and the level they think that we can sustain is about 50% of the contacts that you had before. If you have going forward, they think may be manageable. Daniel?
So, there's obviously discussion about which statute could go up in that place. Do you have anybody in particular that you would like to see honored in that position?
Well, I'm doing everything I can right now on the removal of a statue, but I want to have a robust discussion on what then comes in to the rotunda. I think that could be something really positive for Kentuckians. I believe that we are removing a symbol that divides us, and I think we could have a really amazing conversation and discussion about what unites us. And I hope that all that discussion will remind us of amazing individuals that have, whether it's driving social change or providing leadership, making us proud as Kentuckians. I think it's going to be a really fun process that people will enjoy. Lawrence? Well, there are several options in moving the Jefferson Davis statue. Right now, I believe its intended location is the Todd County Park. Stu?
Following up on Joe's question about schools, parents and students like to have a plan and a schedule, but is there enough predictability with this virus to kind of put that out, or is it going to be marked down in August?
Yeah, the question is, with the unpredictability of of the virus, when will a school plan come out? And I'd turn that around and say a plan will come out, but it's always subject to changes in the virus. You know, all of our guidance that's out there is guidance for right now. If we see a spike, if we learn something new, then all of that guidance is subject to change. Okay.
Not including today because I know the numbers are off. Do you still consider us though in an overall plateau?
So I do believe that we are in a plateau with our COVID cases. What we may not be anymore is in a decline. So we had a plateau, and that was really stable, and it was great news because we were, while we were not escalating or accelerating as quickly as many other states, we were doubling every week until we hit that plateau. Then we hit the decline. Now, at least, again, it's hard to see the data when it's so new, but my belief is we are now probably back around that same plateau, and we probably ought to expect to be in or around that as we move forward with the number of contacts we're going to have, with reopening, with the ability to get together with other people.
I know you have no authority over this decision, right? Your opinion. Would you support replacing Andrew Jackson on the $20 bill with Harriet Tubman?
Oh, I've never been asked that. I think that Harriet Tubman is an incredible American. I think that ways of honoring her work are absolutely worthy of discussion. I don't know if that's the $20 bill or a different way, but I think Harriet Tubman is a wonderful role model, individual, such an important person in history that, again, brings out the very best of us. Chris?
More than a month ago, we were told that the March claims for unemployment were at about 10,000. Yesterday, you said they were in the 8,000 range. And so there's some questions as to whether enough is being done quickly enough, whether processes have been put in place to correct the issue. And what would your message be to those people who are out there that are at the end of their rope, that don't know what they're going to do, and they hear that the number 2 months ago was 10,000 and now it's over 8,000?
And I think we're right under 8,000 today. The question is on the remaining March unemployment claims. Let me start by saying we have had record numbers of unemployment claims. I believe that it is thankfully temporary, that we are going to see a rebound in our economy. How quickly, in part, depends on the next steps that the federal government engages in. I believe we're doing much better than most every other state at processing our unemployment, but that's not helpful to those that, again, haven't been helped to date. Our challenge that we still face is everybody doesn't qualify for unemployment who files. The federal government, even with opening it up a little bit, has still placed a number of conditions and requirements of what we do before granting certain unemployment. And so we are down to a small percentage, a very small fraction of overall claims filed in March. But do I believe enough has been done? No, anybody out there who really needs help, who qualifies for help, who hasn't gotten help, then no, we're not doing enough. Now, we're doing at the moment everything we can, but that's not enough. It's not. And my message to them is we will continue to work. But again, that's on me. At a time when we're facing something of a magnitude we've never seen by a factor of, somebody will have to do it 10, 100. We're working, but our failure to help everybody immediately, that's on my administration. I'm not going to back away from it, but it also means we're committed to doing better each and every day.
In regards to the polling place lawsuit that was filed, speaking with Representative Nemes, he talked about, if polling places are expanded ahead of the primary, that the National Guard may need to be called in to help with those. Does the state feel prepared to help with that in that regard, or just in general, if polling places need to be expanded?
So the National Guard has committed to helping with any county clerk that asks us to help staff their polling places. Right now, it's been taken up by some, but not all, and we have additional capacity to help. And so if we were to have a request based on expanded polling places, it's an area that I believe that we could help and that we could ultimately staff. And that offer came from the Guard, and was really meant to help make sure that so many of our poll workers who fall into the danger zone in COVID aren't there all day. I forgot that I have a couple of written questions. Status of the state of emergency, it continues in effect just like it is just about everywhere throughout the country. There is currently not a stated date of expiration on evictions. We are continuing to monitor not just where the virus is, where the economy is as we're rebounding. Checking on status of reopening of adult daycare. Adult daycare programs are scheduled to reopen June 29th. Guidance outlining this process is being drafted and will be available soon. Additionally, long-term care facilities will begin modified congregate dining and group activities on June 29th. Modified visitation for long-term care facilities will begin July 15th. I know that's something that people have been looking forward to, following the completion of statewide COVID testing for all the facilities. So much like steps we took in other places, once you know it's stabilized, hopefully we can make visitation safe. The testing is underway now and should be completed by the first week of July. Joe?
Submitted a plan yet for the Kentucky Derby and whether or not there will be fans there?
I believe that we have a proposal from Churchill Downs on racing with fans. I do not believe that we have a Derby proposal. At least I have not seen one to date. Tom?
I want to piggyback Karen's question there, just a little bit of clarification. I've seen reports that as many as 21 or maybe even more states are now seeing a second spike in cases. You do not believe that Kentucky is one of them?
I believe that while other states are seeing a spike, certainly our case numbers are going up since our decline. I believe that what we are seeing is a new plateau that could range, anywhere from 100 to 300 or 150 to 350 cases, where we go kind of back and forth, but overall averages out. But we got to continue to watch it. And now that we are reopening, now that we are doing more things, the number of cases, while a very important metric, isn't the metric that matters the most to us. It's the hospitalization and hospitalization rate. It's the ICU rate and our availability of ICU beds if we have a spike that then leads to that. Also looking at the positivity rate being an important one. And we see that ticking up, though we don't see it with a huge spike. But we're certainly seeing, I believe, all over the country, we're going to have more cases if we do more things. The question is it making people sick at a higher rate, or is the virus moving through in a safer, more manageable way? All right, this is going to be one of our shortest days that we've had. I know nobody's upset about that. Everybody continue to try to do what it takes to stay safe. I believe we are going to be back on Monday, and next week we will probably announce a modified schedule on how many of these we do each week. I want to thank you all, and remember, we'll get through it together.